And Audacity in 3, 2, 1.
Hi guys, and welcome back to another episode of the Barbell Lifestyle Podcast. I'm your host, Christina Lynn, and I'm here with my co-host, Marissa Roy. And in today's episode, we're here with one of our favorite guests, Nick Licameli, and we're here to talk all about blood flow restriction training. And we have previously interviewed Nick for episode 7, which was injury reduction and pain management. So if you want a longer intro on who he is, we recommend taking a listen to that episode. Not only will you get some more background on him, but it is jam-packed of some really good information. But if this is your first time with him, Nick, how about you give us a little summary and a little bit of your background on who you are?
Yeah. So, if you said I'm one of your favorite guests, everyone is going to say that they're happy to be here as a guest on your podcast. But I truly am so excited to be back. It's just the first episode was great, and I'm really looking forward to today. So thank you for having me again. Quickly, before I talk about my life, you ladies have a way more interesting life this time in your life. So huge congratulations to you, you gals, and everything to come. So I wish you guys all the best.
Thank you. Thank
you. And if you're new here and you're listening from Nick's profile, if you're curious about what the heck he's talking about, we have episode 43. We actually just did a life updates podcast with all the stuff that's been happening. So we'll talk about it a lot more there too.
Yes.
All right. Geez, now I got to talk about myself. All right. So yeah, thank you again for having me. I guess the quick version of who I am. I guess I'm supposed to start with what's important. So first, I'm a husband to my beautiful wife. I'm the father to 2 beautiful baby girls, 2 years old and 5 months old right now. So when this comes out, the way time is flying, who knows how old they're going to be, because baby years don't obey rules of any other time and space. Professionally, I am the director of an outpatient physical and occupational therapy clinic here in New Jersey. I'm also the injury reduction and management specialist with 3D Muscle Journey. I'm also part of the BFR Pros with Dr. Nick Rolnick. Make different content with Nick. We do different courses, online courses, in-person courses. And I also have my own business, Strength Together Incorporated, and that's where I do virtual consults with athletes and trainees. So that's basically me in a nutshell. And I'm also a competitive natural bodybuilder. I have my pro card, which doesn't mean anything, but I guess it's worth saying. Yeah, it's pro cards are just the result of who's next to you on that particular day. So I am a professional natural bodybuilder, but take it for what it is. So yeah, happy to be here.
Yeah. So from all of that, guys, just so you know, the only piece that makes Nick credible of all of that is his pro card.
Exactly.
So if someone's a pro natural bodybuilder, they can tell you what to do and it'll be good advice. Everything else, physical therapy, just throw it out the window.
Exactly. You know what? I should mention that similar to a pro card, I have my doctorate. So because I have doctor in front of my name, that means anything I say about any kind of medicine is to be taken as gospel. So I'm Dr. Nick, and I'm a pro natural bodybuilder. So that's pretty much all that matters.
Now, Nick, I can't remember if we asked you, because since it was so long ago, I still can't believe it was episode 7, but yeah, do you have any plans to compete in the future?
Good question. So like I said, I have a 2-year-old and a 5-month-old, and my last competitive season was 2018. So definitely some planned off season with life changes that were happening. I've continued to train throughout the babies, throughout the pandemic. I have my own little setup in my basement, so I was able to continue training with not a hiccup in anything except lack of sleep. But that being said, I'm considering maybe 2022 stepping back on stage. I'm judging for the second year in a row the Mr. America competition, which is actually this weekend at the time of this recording. So I guess two or 3 days. I'm judging that, and I'm also commentating it. So that's going to be cool. You're all going to hear my voice if you tune in to CBS Sports with the Mr. America. Aww. So just being involved in that show and watching it grow. We started it back up in 2020, which was like an impossible deed, but we did it. And now 2021 is huge. There's a lot of pros in it. Philip Ricardo Jr. is competing in it. So
really?
Yeah.
I didn't know that.
Yep. He was a judge with me last year, and I was excited to see him again and hang out with him again. Then I realized he was going to be on stage. So a lot of big names in it this year. So considering maybe competing next year and having the Mr. America kind of be my final competition in the fall, but nothing is set in stone yet. So we'll see where life takes me. But with bodybuilding, the stage is always there. So I want to make sure I'm in the right mindset and everything. If I'm going to do a prep, I want to do it right. So tentatively, maybe 2022, but we'll see. So yeah.
Very exciting.
Yeah, and I had no idea about the Mr. America competition. That's really cool. We actually have, so I do some part-time stuff with Core Nutritionals, and we have three athletes that are in the like TV series that they're making for it.
Yes.
And so they're all competing there. So yeah, I'm really excited to watch, and now I'll know who's going to be commentating.
Yeah, I'm excited. It should be good.
Cool.
Awesome. Yeah, well, Marissa, your coach.
Yeah.
Doing that.
My coach, Brandon, is actually competing in men's bodybuilding as well. So like he's one of the athletes too. So that's really cool. Small world.
Yeah. Well, I mean, it's a small world within our like micro bubble of natural bodybuilding.
Yes.
Yeah. I forget that sometimes. I'm like, oh, wow, there's so many people and it's like such a small world, but really like we are the niche.
So real quick story. I don't want to get too off topic, but at the at WMBF Worlds in 2019, I was there with Eric Helms and Jeff Alberts and Alberto Nunez and the whole team, their significant others. So it was really nice to see everyone. We spent the entire day at the show, people coming up to, not me, Eric, and like saying like, oh my God, Eric, can I take I was like the photographer, like they're, hey, like guy on the side, can you take a picture of Eric Helms and me? So a whole day, people coming up to Eric and thanking him for everything he does and how he's changed their life and their approach to training. And so we leave the show and we go to Cheesecake Factory for dinner, and we're standing there waiting, and someone says, Eric. And Eric kind of turned around and he was ready to talk to someone and thank them for the kind words or whatever. And it was like a waiter like calling someone named Eric to sit down at the table. And it was just like, when you're out of natural bodybuilding, like no one knows Eric Helms like from anyone else, but he's such a celebrity within our world. It was just so funny. Like once we're out of the competition, like he's just a normal citizen again.
I was hoping the story was going to be someone's going to be like, hey, Eric, can you help take a picture with me and Nick?
Yeah, I thought that too.
When that day happens, I will make it a big event.
I thought it was either going to be that, or you were going to say like someone yelled Eric and he would turn around, but then there was like a more like celebrity famous Eric like in the room as well. And someone was like, oh my gosh.
Yeah, it's just funny though. Like we get caught up in our own little worlds, and we kind of just, we forget what it's like outside it. Sometimes we have different like debates within our circles, and it's like, man, we're all on the same team here. Like there are people out there, reading articles with thinking that dark chocolate's going to make them lose body fat. Like we're all on the same team here.
Yeah, absolutely. So speaking of niche topics and niche things, today we're talking about blood flow restriction training, which I'm going to guess a majority of our audience has probably never even heard of. And so this is a tool that I've used in the past that I love and hate. And I'm really excited to just give everyone an overview of what it is, where it came from, how we use it, and especially the applications that, we could use with just kind of the current times of some people are still training from home, some people are still with limited equipment, and kind of what that looks like. So let's dive in. Nick, what is blood flow restriction training?
Yeah, so the elevator pitch for blood flow restriction training, or BFR, basically it involves the application of some kind of compressive cuff, either on the arm or the leg, and it's inflated to a certain pressure. And when exercise is performed with the cuff on the limb, it allows us to get to fatigue faster than we normally would and with less load. So basically we can get the same gains in size and strength with lighter loads. So we could get the same effect as training heavy without training heavy. So that has great implications for, those who are post-operative, maybe after a surgery that can't tolerate heavy loads. Could be someone with an injury, could be someone just trying to change up their training a little bit. So I'm sure we'll get into all of that, but that's kind of the elevator pitch. It's the application of a cuff that's pressurized to a certain pressure, and then exercises performed with the cuff on, and significantly lighter loads, and we get the same training effect as if it was a heavy load.
Yeah, and I think the first time I heard of BFR, I think it was through Lane Norton probably, and it was like, here, like tie these things around your arms, and like the only thing that I really heard about it that sold me on it, because like I think this was probably like 4, maybe 5 years ago, I was just such a bro at the time, like such a bodybuilding bro. And so it was marketed as like, you're going to get the sickest pump that you've ever experienced in your entire life. And I was like, all right, give it to me. Like, let's do this. Right. And so I get these things, I order them on Amazon. I probably put them on way too tight, but I just started going, and I was like, wow, I can get the sickest pump in the world with 5-pound dumbbells. But like, that was like my experience with it up until you and 3DMJ started remaking like content on it for like, what are the other purposes? What are the other applications for it? And kind of like around the whole COVID shutdown time, where like I saw some people like Katie Ann Rutherford, she was using BFR at her home gym just to like make her training more intense. And then I started to see these like other applications for it. I was like, okay, like I used to just use it to like be a total bro and like get like vascular as possible, but like this is actually pretty cool. And so like kind of seeing how the maturity of BFR has kind of evolved, because I don't think I was the only one who kind of used it as that sort of a tool too. Yeah. So that was interesting to see how it's changed over time too.
Yeah, when I first got into it, very similarly, I saw it. Lane Norton. Do you remember the Superman like Under Armour shirt he was wearing, like in the video or in the article that he wrote? So there was an article and a video that he made, and he had like this Under Armour type shirt with a Superman logo on it, and he was using BFR, and Lane actually worked with Jeremy Lenicky at the time, and Jeremy Lenicky is like a world leading researcher in BFR. He was one of the originals who started kind of diving into the evidence base behind BFR. But I got exposed to it by Lane Norton, and very similar to you, I ordered some like, it wasn't even a cuff. It was like a strap. It was maybe like an inch thick. And
was it blue?
That was black.
Okay, because I had like a similar one.
Yeah, so I was told, whether from Lane or in a muscle magazine, to tie it with 7 out of 10 tightness. So naturally, if 7 out of 10 tightness is good, then 12 out of 10 tightness would be even better. So I tighten this thing up on my arm, and it just looks like a sausage link, like where you have like the sausage and it gets really, really small and then it gets really like big again. That was like my bicep to my shoulder. It was like just really, really squeezed. And I would just, I would just do my curls or do whatever I was doing. And the pump was obviously crazy because I was just stopping all my blood flow, leaving my arm. And when I took it off, I would get these bruises because I had it tied so tight. And I was competing at the time, and I'm like, man, like I can't use this because I'm gonna have black and blues like on my arms in my poses. So that was kind of how I got into BFR. And then I kind of kept it on the back burner. It wasn't really a big part of my training. And then as more information kept coming out, and then it started crossing over into physical therapy and rehab world, then I started kind of finding out more about it and diving in a bit deeper, which is probably a good segue into where it started and where it's going. So it started in Japan. There was a Japanese bodybuilder who's also a doctor, and legend has it that he was kind of kneeling down for some kind of ceremony that he was at. And after he stood up, he noticed his calves felt really tight and like he just had worked out. So he came up with the idea, what if I were to occlude my blood flow and work out with it? Maybe it would enhance my pump. So that was the birth of this whole thing. And that was actually called Katsu training. And it's still practiced around the world. A little bit different than what we're going to be talking about, but that's kind of how it all started. And then it got into the bodybuilding world, and then it transferred over to the rehab world, and more research started coming out. And yeah, so it's a lot of promising research, and it just keeps coming out and different implications for how to apply it and safety and everything like that. So that's kind of how it started and where it's gotten to now. And I guess my goal, Marissa, you mentioned the content with 3DMJ that we've made. I have a free course with 3DMJ on BFR. It's like over 2 hours. And then I mentioned I also work with the BFR pros and Nick Licameli, and he has a phenomenal course online that's almost like the next step after my course. Like mine is kind of like an intro, and then Nick's really has a comprehensive look at all the research and a deep dive into some of the details. So that's kind of where it started. And so where should we kind of go from there? Like what would be the best way to dive into this?
I had something real quick. So kind of, again, to do that whole full circle, like the natural bodybuilding world is very small. So I was not introduced to blood flow restriction training, but I had done something similar, which was considered a blood volume training, which I did in 2015 for my very first ever bikini prep. And so I was with, at the time, it was Iron Management Nutrition Systems. And so that was with Anthony Kim.
That was with Brandon too, right?
And Brandon, Marissa's coach. So they were kind of like co-coaches for this team. So I did a lot of blood volume training. So I had I'd have like a regular, like heavy lifting day for arms or like upper body. And then I'd have like a blood flow for legs. And then the next upper body would be the blood volume. So I didn't have the straps, but I was lifting like 3 seconds up, 3 seconds down for like anywhere from between 14 and 20 reps. And I just remember doing like bicep curls and like wanting to die. So I was like, this sucks so bad. But yeah, I just thought that was so funny because it's like, here's my first coach, my first team, and now it's Marissa's coach.
Yeah. And so I actually thought of that when we were just telling stories, because like that was when we first met. So like we're going super full circle right now. When Christina and I first met, and I was like thinking like about the blood flow restriction training, and the only other thing that I've done really that like reminded me of that is we like met up at her gym. And she takes me through this workout where we're using 5-pound dumbbells on curls. And for some reason, I just can't lift them by like rep 20. And so, yeah, that was like another kind of introduction to it too. Just kind of seeing how all that worked. So yeah.
It's humbling.
It's very, very humbling.
Yes.
I'm actually curious, Nick, what is the time frame that it originated, the Katsu training in Japan originated? Like how far back does this go?
I want to say the 70s.
Okay.
So yeah, it had a couple growths from there. And like I said in the beginning, it was very much like, let's just wrap some cuffs on and see what happens. Yeah, so about from the 70s until now.
Okay. So about 50 years. So yeah, I guess where we want to go from here really is just talking about how do we apply it. So like the physical therapy context, injury context, deload context, and just kind of going through them one by one and really just giving the audience a better idea of where they can actually use this tool.
Okay, cool. So you may have to redirect me after I start talking if I kind of forget all of those points that you just made, which are awesome. So I guess we'll start with safety. Like if people are going to stop listening to this, we should probably talk about safety before they sign off.
Good point.
Not that anyone should stop listening, of course. All right. So how do we apply it? So there are BFR units out there that are able to automatically measure what's called limb occlusion pressure. Limb occlusion pressure is when 100% of arterial blood flow is occluded. So just a real quick recap of how the kind of circulatory system works. We have arteries and veins, and the heart pumps a bunch of blood out of the heart with a lot of force, and it goes into the arteries and down into our tissues. Has a lot of force, a lot of velocity. After the blood goes into our tissues, it gets kind of recaptured by the veins, and then the veins kind of make it trickle back to the heart. Venous flow is much slower and has less velocity than arterial flow, because the only thing that's making that blood move, for the most part, is that initial pump from the heart. So it pumps, goes in through the arteries, and then whatever force it has left from the arteries, it goes back through the venous system back into the heart. Now our muscles, the contractions of our muscles can help kind of pump that venous flow back into the heart. Main takeaway is that the arteries have really fast blood flow and the veins have very slow blood flow. So like if you watch like an old war movie and there's like blood like squirting out of someone, that's likely depicting an arterial injury, because all of that blood, that's every pump of the heart is shooting that blood out with a lot of velocity. If it's kind of like a slow bleed of an injury, or like if you scrape your arm on the ground and the blood is just kind of there, it's not like shooting out, that's most likely a vein that was kind of, opened up. So that being said, the occlusion pressure, the limb occlusion pressure, is 100% occlusion. You're occluding the arteries and the veins. We don't want to exercise at that point. That's exactly what your systolic blood pressure is. So if we take a blood pressure, you pump the blood pressure cuff up until you don't hear a pulse anymore. So that means we've occluded arterial flow. And then you let the pressure out until you hear that first boop of the pulse. That means that is your systolic blood pressure, and that's what your LOP, or limb occlusion pressure, is. So the pressure that we apply to the cuff when we exercise is a percentage of that LOP. So that percentage of full occlusion. In the arms, it's anywhere from 40 to 50% occlusion. And in the legs, it's anywhere from 50 to 80% occlusion. So some units will do that automatically, just like an automatic blood pressure cuff. Some of them, you press the button, it just inflates, deflates, and tells you your blood pressure. Other blood pressure units, you have to manually pump the cuff up, use a stethoscope to hear the pulse, and then manually watch the pressure and get the blood pressure. Same thing with BFR. Some units require you to do the same thing. You listen for the pulse with a Doppler ultrasound, or a stethoscope, or even just your fingers, or a pulse ox, like that little thing that you can put on your finger to measure your oxygen and your heart rate. You can use that, pump up the cuff until you don't feel that pulse anymore. And then whatever the pressure is, you take a percentage of that and then let the air out until you get to that percentage. And that is that's the pressure that you're going to want to work with. If you don't have access to any of that stuff, the very, very, very last resort is 7 out of 10 tightness. Now I say that, I say that.
So what you're saying is they were right.
The quick and dirty way to do this is to pump it up to something that seems relatively tight. Make sure you can feel your pulse. If you can feel your pulse, at least you're not fully occluding your arm or your leg. And then if you feel your pulse and it feels relatively tight, 7 out of 10-ish, then you can work with that. That's a good rough estimate. The pressures don't have to be exact for efficacy, but we want to make sure that we're not fully occluding the arm or the leg as we're exercising. Right. So that's how you apply it.
Yeah. So when we're feeling for a pulse, just for the audience clarity, are we feeling at below the point of the cuff for the pulse? Is that right?
Good question. Yeah. So in the arm, you can feel just like your typical pulse here. And then in the leg, you can feel probably better to maybe if everyone just like Google the pulse in the ankle, but you have one like right in the front of your ankle. You have another one on the side of like your ankle bone that sticks out. So there are a couple places you can feel your pulse in your leg as well. So yeah, you're gonna look for the pulse, I guess distal, which means kind of further away from the trunk, distal to the cuff.
Okay. So for those of you who are listening audio only, just Nick pointed to his wrist for the upper body. So on the wrist where you would normally feel for a pulse. So just for clarity's sake there. Yeah.
That's a shame that people aren't looking at the visual of what's going on here. I have my nice red shirt on for everyone, and they're going to go listen to just the audio.
We do have YouTube video watchers. We do, but it's just not the majority, unfortunately.
Nah, you guys are missing out. All right, cool. So that's how we apply it. And then once we have it on, how do we do it, right? What's the set and rep scheme? What exercises do we do it with? What we're going to see the most, and what's most common in the research, is to have one set of 30 repetitions and then 3 sets of 15 repetitions after that. And we're using anywhere from 20 to 50% of our 1 rep max. So we're talking like very, light loads compared to what we usually train with. That 30, 15, 15, 15, I don't know how many 15s I just said, but whatever. All right.
Yeah, I think that was right.
That set and rep scheme is nothing magical. You don't have to do that. It's just a way for researchers to have some consistency across the board with studies. So as long as you're getting to fatigue and are going close to failure, you're going to be okay. That can be 8 reps, that could be 15 reps, that could be 25 reps. As long as we're getting to fatigue, it's okay. But what you're going to see most in any kind of BFR literature is that 30, 15, 15, 15. As far as exercise selection, it really is up to the situation and up to the individual. Why are they using BFR in the first place, which I'll kind of get to right after this. Typically, I would probably start someone, if they're an athlete and they have experience training, I would probably start with someone with single joint exercises. So things like curls, tricep press downs, knee extensions, leg curls, things like that, with on the low end of the pressure. So if in the legs, it's 50 to 80, maybe closer to 50 or 60% of that LOP, just to get a feel of what it feels like. And then you can gradually progress to higher pressures as the athlete gets more and more used to it. If we're talking about in the physical therapy setting, and maybe it's someone in their late 60s and they're not used to exercising, and they just had, say, like a surgery on their knee, but I want to use BFR, what I would start with that person is, again, on the low end of the pressure spectrum there. And I would just have them kind of sit on the table and do some isometric quad contractions, just to get a feel of what it feels like to contract that muscle with the BFR on it. And then gradually, just like any kind of exercise, gradually over the next couple of weeks, we progress the range of motion of the movement. So from isometric to full range motion, we could progress the pressure, we could progress the weight, we could progress to multi-joint exercises like squats, lunges, and things like that. But again, it's going to matter what the goal is for using BFR. So before I get into that, was there anything that you guys wanted to kind of chime in on, or want to just talk over you?
No, I think that it coincides very well with episode 7 when you talk about injury and like rehab and like what's your goal. And I think that that's really important to focus on before you get into any sort of training, because that's really going to direct and give your training more purpose, and it's going to be more intentional. Yeah.
We all got the point. It's all good.
Yeah. Got it. I'm not a doctor, and I don't have my pro card.
Yeah. You know what? If you say it confidently, everyone's just like, oh yeah, everyone just nods along.
Intentful, yes.
Yeah, you're 100% great point. It comes down to the goal. And with BFR, so I guess before we get into that, I'll just say that BFR is not something I use in my own training very often. And it's not something I use very often with my patients either. It's a very specific person that would benefit from it. And at the end of the day, I don't want to kind of seem like I'm a snake oil salesman and trying to sell people on BFR. At the end of the day, if you can lift heavy loads, lift heavy loads. You're better off training with your normal loads and really putting that the load onto your joints and soft tissues rather than using BFR. So that being said, if it's a person recovering from, like I said, surgery, then we'll start with those isometric exercises, depending if there's post-operative precautions like weight-bearing restrictions. And BFR has been shown to reduce atrophy or reduce muscle wasting after things like an ACL repair, which is huge because that's one of the reasons why the rehab takes so long, is we have to get that quadricep back nice and big and nice and strong again after surgery. So the use of BFR, even passively, even just inflating the cuff and deflating it for a certain time frame, that has even been shown to reduce atrophy and strength loss. So that's where we kind of use it with that post-operative patient. Start with some passive BFR, then work into some isometrics, then work into some longer range of motion things, and then work our way back up to squatting and lunging. Again, the reason why we would do a squat with BFR is because this person post-operatively is not able to really do a squat because that leg is so weak. If they were able to do a squat, then I would just take the cuff off and have them do a squat. But the reason why that post-op patient would probably use this with a multi-joint exercise is because they need that little extra pre-fatigue part of BFR to kind of get that same training effect with lighter loads. If someone is an athlete, a bodybuilder, weightlifter, football player, one of the cool uses of BFR could be as a deload or in season. So say, take a football player who practices all week long and then plays a game on the weekend, rinse, repeat for the whole season. That athlete is still going to want to train. They're still going to want to strength train during their season, but they're probably not going to want to do heavy squats, heavy leg presses, deadlifts, and things like that. So what you can do is you can use BFR with that athlete so they still get the training effect of heavy loads, but they're not getting the stress on the joints and soft tissues. So that's a great way to work BFR into a completely healthy athlete's regimen. If it's in kind of our world, like a bodybuilder or power lifter, great for a deload because we're limiting the load that's put on our bodies, but we're still maintaining that training effect. That being said, deloads can happen for many different reasons. It could be because we're getting some aches and pains. It could be because we just need to control alt delete a little bit. It could be because we're just mentally drained and we need to just have that deload. For that person, if we have a person who just needs to take a week to back off from that like metabolic stress and that muscle burn and really pushing it and they need like almost like an intensity deload, I would not recommend BFR for that deload because BFR is quite painful and you really need to go there to kind of go through the set. So for the person that needs a deload but still wants to feel like they're training hard, BFR is absolutely perfect because you're still going to get that feeling like I'm training my butt off and I'm working at 10 out of 10 intensity and I'm pushing myself and I feel my leg is going to burn off. But they're not getting that stress on the joints and soft tissues. So definitely good for some people. But again, if they need that deload of intensity, they need to just like clear their mind of any kind of like gritting your teeth and going there, then BFR is probably not the best option for that person.
Yeah. That made me think of a lot of our clients who will say like, hey, I'm going out of town and I'm going to be at this hotel and they only have a small rack of dumbbells. Like, what should I do? Am I not going to be able to do my training? That might be something that would be a good thing to implement. It's like, hey, like this, you may not be able to squat or bench what you normally do, but if you're able to implement this, you can still get a pretty killer workout. And of course, bringing the bands, they're lightweight, so you can travel with them, and it's not going to be like bringing your whole squat set with you.
Yeah, that's one of the great uses of BFR, especially with the pandemic. Like Marissa mentioned before, people were working out in their houses and their apartments, and all they have is maybe a case of water and a chair, and they're doing Bulgarian split squats on a chair with a case of water, or
that sounds awful.
Or some body weight squats, or anything. That's what we're left with. So BFR is fantastic for those kind of situations. Just like you said, if you're traveling and you have nothing but a hotel gym, or maybe just a hotel room and not even a gym, you can still maintain that training effect with lighter loads. And we talked about how it's uncomfortable. We should probably explain why, like the mechanism behind it all and why it's so uncomfortable. Basically, if we're doing an exercise like a curl without occlusion, blood is going into our bicep and then it's flowing back out. So blood's going in, it's bringing nutrients, it's bringing growth factors, it's bringing metabolic byproducts that are being formed in the muscle from the fatiguing exercise. They're forming in there and they're getting swept out with blood flow. With the BFR, what it does is it keeps that blood in the muscle. So all of that metabolic byproduct, all of that acidity that would normally get flushed out of the muscle is staying in there, and it's just hanging out in there and making your life miserable. So it's very you get an insane pump and you get an insane muscle burn, and because you're stopping those metabolic byproducts, that waste that should be flushed out, you're stopping it. So it kind of sits in there a little bit. What that does is it taps into the type 2 muscle fibers a bit faster than otherwise. So type 1 muscle fibers are the ones that we use first. So they're the ones that we use when we walk down the street. They're the ones that we use when we lift up a water bottle to our face. And they're the ones that we use in the first 5 reps of a set of 15. They're just there. They're there to, I have a cat jumping on me right now. I'm sorry.
This sounds like a Christina problem.
Can relate.
So the type 1 fibers, and then if the activity that we're doing requires a bit more, then the type 2 fibers are going to get called in. And the type 2 fibers are power. They produce a lot of, not that they're stronger than type 1, but they produce force rapidly. And they have the most potential for growth. A bodybuilder, though, they're going to want to grow both types of fibers. So I don't want it to get kind of misconstrued that we only want to tap into type 2 fibers, because as a bodybuilder, we want overall growth. So we want to grow the type 1 and type 2. If the athlete is maybe like a shot putter or someone that just needs power, then maybe I would say that person wants to bias the type 2 fibers because they want to build that muscle with as much type 2 fibers as possible. But for most of us, we want to just build both. So for example, if we are running on a track and we're just kind of coasting and we're able to keep the pace that we're going at, those type 1 fibers. They use oxygen for energy, and we're able to increase our breathing rate to supply those type 1 fibers with the energy they need to complete the exercise. Then all of a sudden, if you come up to a hill and you start running up the hill, now you're starting to breathe heavier and heavier, but you just can't get enough oxygen in to supply those type 1 fibers. So what happens is we tap into the type 2 fibers and they don't use oxygen. So then we tap into those, and that's when we start feeling that muscle burn. That muscle burn is those type 2 fibers kicking in. So what BFR does is it basically gets into those fibers faster than normal. So that's the reason why it's very uncomfortable. And so it kind of pre-fatigues us. It makes us less efficient. So if we were trying to lift heavy and improve our performance in the moment, this is not the time to do it. This is like if you're trying to drive, it's like putting if a ship, an anchor. It's like putting an anchor behind your car if you're trying to go fast. Like it makes you work harder, doing much less work.
Yeah, man, could you imagine just having a heavy load with that? I can't even imagine what that would be like. I'm lucky and happy to say that I've never experimented with that. But I do have a question for you. So with the recovery demand of BFR, because you've mentioned, it's useful for deloads, it's not as much stress on, of course, the joints and the tissues in terms of heavy loads on our spines, on our joints and that sort of thing. And what I have heard is that there's just not as much like DOMS from BFR. Is that correct?
Yeah, it's a great point. There's much less muscle damage with BFR than with traditional training. However, it's like anything else. So if it's the repeated bout effect is going to take place just like it will with anything else. So the repeated bout effect, basically the quick and dirty definition of the repeated bout effect is the more that we do something, the more that our bodies get efficient at it and adapt to it. So the first time that we went into a gym, we probably got really sore because we never did that activity before and it was novel to us. Same thing happened, but then as we keep training, it gets less and less. We get less sore and less, you do some kind of new training technique that is able to get you sore, but it's harder to get sore as you keep training. Similar with BFR. So if you start with BFR and you don't gradually work into the pressures and you just pump it up to the top end of the spectrum of pressure and you go to failure and you do drop sets and you likely have some muscle soreness. But if you keep doing that over the course of a couple of weeks, then that muscle soreness would likely get less and less. So in the beginning, you may get some soreness just because it's a new way to exercise. But in general, the muscle damage from BFR is less than without. And the other kind of thing that just made me think of is, so kind of explaining the mechanism by it just before, how it kind of pools the blood in the muscle. It's the same mechanism basically as something like a drop set. So a drop set, you are bringing yourself to fatigue. You're accumulating those metabolic byproducts. You're feeling that burn. And then without a drop set, you would just put the weights down and the blood would flow out of your arm or whatever muscle you're working, and the burn would stop. With a drop set, you're not letting that happen because now you're calling upon it again to work. And then you're putting the weight down. And as the blood is flowing out, you call it to go back in. And as the blood's flowing out, you call it to go back in. So you're kind of repeating that and keeping that blood in the muscle, and you're just keep fatiguing it, similar to a rest pause set as well. So BFR is not some like magical, modality. It's really just tapping into like the principles of strength training.
Yeah. Yeah. And I think one thing to kind of really touch on with BFR, because at this point in the episode, and we've alluded to it a little bit, but at this point in the episode, we've kind of painted it to be this thing where it's like, okay, now we don't have to train heavy and we can still achieve, that feeling of the burn, good, get some soreness the first time you do it, et cetera. So I want to really just clarify, like, in terms of results, because I feel like we have a results oriented audience, why it's not advantageous to just be doing BFR all the time as like your programming in air quotes, right?
Yeah. So that's a great point. And really, if you can lift heavy, kind of like I said before, if you can lift heavy, you're going to be better off using the heavy loads. You're going to be able to progress your exercises more. And you should only use BFR to supplement if you have a part of your training where you want to focus on metabolic stress for some reason, then that's when I would say to use it. But like I said, I don't even use it in my own training that much. I'll do it if I want to change things up a little bit. If I forget what it feels like, and as I'm producing content, I want a fresh memory of what it feels like. Or hypothetically say that there was someone who had a bunch of babies in their house and they get elbow pain when they hold their babies and they just get heavier and heavier and heavier and heavier, then that would be a good time to use BFR too. So yeah, if you can train heavy, train heavy. You can give BFR a shot if you want to see what it feels like, and but keep it as a tool in your toolbox, and stick to the compound movements. Progressively load them, and just like you normally would, but just know that you have BFR in your back pocket if you need it.
Yeah, I was thinking, so I feel like while a lot of people aren't familiar with it, I feel like they're starting to pop up a little bit more in gyms. And so I've seen, even at my gym, there are a couple girls who will literally wear the bands right under their cheeks, and they wear them their entire workout. And so I think that they're starting to, like, there is a little bit of misinformation. Do you think it kind of stems from getting a really good pump? So people think that they're getting a really good workout, therefore this is something I should do every single time I train legs, or if I want to grow my glutes.
Yeah, great. That's a great point. I think there are a couple of things that are at play there. I think the main thing is, like anything else, when people get wind of something that they hear is effective, especially like we all fell victim to, especially when that seed lands on soil that is just susceptible to that. More is better, like more intense is better, more pain is better. When that seed falls on that soil and it just grows like a weed. So I think part of it is it's this quote unquote new or trendy thing. They know that maybe there's some science behind it. So then everyone just kind of tries to do it. And then that's where we get misinformation. Just like anything else in fitness, or whether it's nutrition, people get wind of something and then they kind of take it and run with it. And then people who have good intentions, likely, but maybe they just don't know too much about it, they just dive in and try to produce content about it or try it themselves. And then, yeah, I think the thought of harder is better, bigger pump is better workout. I think that mindset too is a reason why BFR kind of latches on people who are just trying to look for the next best thing. So yeah, I think that's one of the reasons why I try to produce this type of content, most of it for free, because I just want to kind of get that word out and have that new person to the gym trying to find themselves. It's similar to like a teenager going through like adolescence, like that time in that person's life, they're so influential, and you just hope that they run into like content from like Tom Bilyeu or who else is like very influential? I don't know. Or they fall on like Simon Sinek and they just like dive into that rather than like go down another path when they're very easily malleable. That's like a new person to training. We want to get that person so they don't have to do what we did and dive into the muscle magazines and make mistakes on our own. And then after the fact, if we're still kicking, then stumble on a 3DMJ or a barbell medicine or clinical athlete or any of those guys or guys and gals. So yeah, I'm trying to be that first entry point for people as much as I can to kind of prevent that from happening. But you're right, Christy, I do see that more often. People just kind of wearing it, and you mentioned kind of wearing it their whole workout. Is probably a good segue into how long are we supposed to keep this on. There is some research on using it for cardio. So if you're using it for cycling or walking, some good studies on rowing, you can keep it on for anywhere from like 20-25 minutes. That would be okay. If we're doing resistance training, then it would really only be like 8 to 10 minutes, because how long does 4 sets take? Those in that 30, 15, 15, 15 kind of set and rep scheme, usually there would be 30 seconds of rest in between. So however long that would take, that would be how long you would keep the cuff inflated. And then in between your sets, I'm sorry, not in between your sets. In between your sets, you're going to keep the cuff inflated. when you're done with all of your sets, you can take it off and then pump it back up before your next exercise if you do another exercise with BFR. There's also intermittent BFR, which is kind of like what I just made the mistake of saying, is you could deflate it in between sets. So that's a great entry point for people who are unaccustomed to exercise or maybe don't like the discomfort. I know there are people out there that don't like the pain of working out. So that's something that a lot of research is coming out on. And I'm actually involved in a systematic review. I'm a co-author on it about intermittent BFR. And it seems like there's similar outcomes with deflating the cuff in between the sets and then inflating it during the sets. And it's much less discomfort than keeping it inflated. So that's really cool if we're talking about bringing this modality to many people other than just people who like to feel the burn and kind of take it to the house every time.
Yeah, I was going to say, like, we're talking about, all BFR and how painful it really is. Like, I don't want to understate, like, it freaking hurts to do BFR, right? And you guys brought me back to a trip that I took. I visited some friends, and it was in 2017, like early 2017, when I was like very much in my bro years. And I brought my BFR bands to the gym, and I was like, I got to show you guys this thing and you're going to love me for it. They all hated me for it. And so I like put everyone through like this whole BFR thing at like leg workout. And I just remember I was the chick like walking around with the bands just like still tied up on my legs. And it's so funny. But yeah, let's talk about how people actually like BFR. What's your experience with that? Because I know like we're sitting here and like probably some of our audience is like, yeah, I want to feel the sick pump, sick burn. And then there's the people that we've talked about with, physical therapy, older patients. Like how does this even, go by with them?
Yeah. So I think I have like a selection bias because I kind of know the patients or athletes that I would even bring BFR up to. And then I have the patients and athletes who I don't even try to bring it up to. So I don't even know if they would like it or not, because I'm just assuming that it's not for them.
Yeah.
So most of the time I only offer it to the people that I know are going to take to it. I have a patient now who had a meniscus repair. So he had a bucket handle tear of his meniscus. Majority of meniscus injuries don't require surgery, and you can work around them and train around them. However, bucket handle tear like this patient had, was this type of thing needs a meniscus repair, which is weeks after surgery, is non-weight bearing. It's this very extensive recovery, and he loves it. I mean, we started early on post-op. I communicated with the doctor, let the doctor know that I was going to be doing BFR. He said, go for it. And we started from, very early on, just doing those isometrics on the table. And then now he's doing leg press. He's doing leg extension with it on, and he just loves it. Like he's one of those guys that like, he's just like, give me more, like I'm good. And so most of the time people do like it. If it's an athlete that I'm working with, it's usually like a breath of fresh air. Because if it's an injured athlete, a lot of times we wrap our identities around us being an athlete. And the fact that BFR can allow an athlete to still train, and not only still train, but still feel intensity, like an intense workout, it's very much mental and physical benefit when it comes to the athlete who really just loves training. It's part of who they are. It's really a nice way to maintain that through injury, which is hard enough to kind of get through.
Yeah, I think I mentioned this in episode 7. I talked about how I worked at a tennis club, and this was kind of my introduction to personal training. And I did what was considered, it was like slow-mo training. So you wouldn't do the traditional like 4 sets of 10 to 12. You would just do 1 set. You would do as heavy as you could, and you just went till failure. And so you just did 1 set, and it sounds like, oh, well, that's kind of easy, but the intensity is crazy. And so they used it a lot with the older clients who couldn't do the traditional, like super, super heavy anything, but they were still able to have a very intense workout, just in a very different manner.
Yeah, very similar. Yep, exactly. You're allowing the person to feel like they're getting a good workout without provoking their pain or without going above and beyond what they're capable of doing.
Yeah, I remember the one of the first times that I actually had the back injury that kind of just, comes and goes that I deal with. And Nick knows all about that because we worked together on it too. But one of the first times that I ever actually felt like I hurt myself with my back lifting was in 2017 as well. So it was like kind of that phase where I was like, still in my bro year and like really just chasing the pump. But I was very determined at the time. And it's crazy looking back at this experience because I didn't have pretty much any of the knowledge that I have now, but I just pretty much said, okay, I'm smart enough. My back hurts. I probably can't put a bar on my back and not have any pain. So let me see what kind of movements I can do without putting something on my back. And so I came up with, dumbbell step ups, dumbbell split squats, all the seated machines, all of that. And then BFR was this thing that I had, been chasing the pump with a little bit. And I was like, maybe I can like take this tool and use it. So I literally like kind of intuitively did it at that point. And when I discovered BFR hip thrusts with like 135 or like even less weight than that, I was floored. That was the day where I was like, okay, I can still, like you said, I can still be an athlete. Like, I think there's so many psychological benefits for people kind of in the injury situation with BFR to really find themselves, like when you say like you have to go there to do BFR, like you have to go to a dark place and really tolerate a lot of pain when you're doing it right. And so that was something that kind of really just kept me going during that time frame, because I think I took a couple of months off of doing any like heavy compounds at that point in my lifting career. So kind of looking back, it's interesting going through that in my head, like, hey, I actually kind of used it right, even though I was, a little bit too much of a bro at the time.
Yeah, I think that's a great point. And it really is consistent with just physical therapy in general. The way that kind of we talked about in our last episode, how it's all about showing the patient or athlete what they can do and not so much what they can't do. And it's not about taking someone who's a high level weightlifter or bodybuilder who's used to squatting, deadlifting, leg press, all those things, and saying, okay, you have low back pain. What we're going to do is we're going to do some bird dogs, we're going to do some dead bugs, and we're going to do some bridges. We want to make sure that we could show them what they can do. Just like BFR, we want to expose them to show them what they can do and give them exercise modifications so that they still feel like an athlete. And then the one thing that you mentioned that also kind of sparked somewhere else that I want to go with this is the glutes. So what happens to the muscles that aren't downward from the cuff? So so we said distal means away from the trunk. So if we put the cuff right under the shoulder, then distal would be like the elbow and the hand, and proximal would be like the pecs and the deltoids. And by the way, when you apply the cuff, it should always be the proximal most point of your arm or your leg. So it's going to be up near your armpit and up near your groin. The reason for that is because there's more like soft tissue up there. So there's more muscle, there's just a bigger piece of meat, so to speak, up there. And it kind of protects the nerves that kind of run through there. So think about hitting your funny bone. That nerve is pretty exposed. You can just kind of tap it on a chair and you feel like a zing into your hand. Similar where you don't have like a funny bone in your elbow or your groin. So there's more cushioning for the cuff to inflate and not irritate any nerves. So the proximal hypertrophy or the muscles, so your chest, for example, if it's on your arm, and your glutes, for example, if it's on your leg, we've actually seen studies where there is, we see those muscles getting an effect from BFR. And now that makes us scratch our head because we're not occluding blood flow to or away from those muscles. So all of the mechanisms that I mentioned before, like, how does this make sense? Like, it doesn't make sense why we would see benefits to the muscles on the other side of the cuff. What we think is happening is because we're pre-fatiguing the muscles that are distal to the cuff, we're forcing those proximal muscles to get activated a bit more. So if we're talking about a bench press, the triceps are getting fatigued prematurely, so your chest is going to have to be a bit more active to execute that movement. With a squat, we're fatiguing our quads and our hamstrings, so the glutes may have to work a bit harder to execute that movement. What I would say is use that as a cool side effect. I wouldn't go about using BFR to grow your glutes or go about using BFR to grow your pecs. I would say if you are doing BFR, know that that's a cool side effect, that you can get some hypertrophy in the muscles proximally. But I would say if your goal is to grow your glutes or your pecs or your lats, just lose the cuff and just train those muscles, like with traditional training.
Yeah, something you actually made me think of with that example, because like I've done that just because I'm just like, I don't want to put 200 pounds on my hip thrust and like, do that. Right. But it made me think of this tip that I like to use when I'm doing hamstring curls, whether it's seated or lying. I will like point my toes instead of flexing my feet up. I think the natural thing to do when you do a hamstring curl is to like really tighten your calves and flex your feet up and dorsiflex. But I will actually do the opposite and point my toes down because it basically like disengages your calf. And so like I was introduced to this as this like magical tool to like make your hamstrings grow more, right? Really all it is it's just keeping your calves out of it as a stabilizer. So your hamstrings have to do more work. So it feels harder. It feels like your hamstrings are getting more activated. And if you have any issues with activating your hamstrings, it's a great way to kind of cue that. So that's something that I do, but it's like, what's the net effect of it though? Because if I were to flex my feet up, I'd probably be able to hamstring curl like 20, 30 more pounds. So like, is my hamstring actually doing any more or less work? Probably not, but like same thing with the hip thrust. It's like, okay, if we're pre-fatiguing what's down below the glutes, which is the quads and hamstrings and however they may stabilize or work in the hip thrust, we're basically just like taking that out by having the bands on. And so the glutes feel like they're doing more work, but again, we're using like 25% of our 1RM. Like I'm using 135 and just pumping out reps. So like how much more work is our glute actually getting? The answer is like, you don't know, like probably net neutral. And it's just a different way to experience that stress and that fatigue.
Yeah, that makes me think of like an incline barbell press or incline dumbbell press. Like, so in my mind, I think Eric Helms was the first one to say this. And it kind of like, I was listening along and I was like, yeah. And then I was like, oh, that's a good point. Like, that's just tipped my world upside down. So if the goal is to build a big chest, I used to think it was intuitive that I would do some incline presses, I would do some flat presses, maybe do some decline presses, because you want to grow your whole chest, right? So, but then if you think about it, just like you said, Marissa, like if yeah, maybe I'm getting more upper pec activation on an EMG when I'm doing incline presses, but maybe I'm getting less overall pec activation, and it's just by default because you're not activating the bulk of your chest, so you're just activating a smaller part of it. Whereas a flat bench press, maybe that would cause more overall chest development, which is my ultimate goal. So yeah, I think that's a great point. And I never actually made that connection like you just did to BFR and proximal hypertrophy. It's basically the same exact thing.
Yeah. And with the incline press example, it's like, well, everyone knows that you lift more on flat press than you do incline. So again, the stimulus is just less.
Yeah. I actually have like a world-class power lifter that I'm working with, and he just loves incline press and he can't flat press.
Really?
Like he's not good at it and he doesn't like it. It hurts his elbows. but he's good with incline press, and he puts up like almost the same weight. So he's just a genetic freak. But for the most part, yeah, definitely a flat bench you could put more weight on. So you're probably getting more overall development.
Yeah. Yeah. Oh, wow. That's an anomaly right there. I have not seen that.
Yeah. He's definitely an anomaly.
Yeah. No, I really like where we've taken this whole conversation, and like just all the different nuances and connections that we can make with BFR. I don't know if there's much else that we're missing or much more that we could add. Really, the one thing that you mentioned with like where to actually put them, that was one thing where I was like, oh shoot, we have to mention that. So yeah, putting it at that where the shoulder meets the bicep, and basically like the hip crease with where we want to put them. But I don't know, Nick, is there anything else with BFR that we haven't touched on yet?
You know what is a pet peeve of mine is when you're listening to a podcast and the host asks the guest, so is there anything else that you want to talk about? And they say, no. And then they proceed to mention like 9 things that they want to talk about. So I think we touched on a lot. I guess we could finish with maybe like where the research is going, like down the road, and maybe some things to watch out for.
That's great.
I thought you were about to call Marissa out on something. I was like, damn.
Oh, never. This is my home here. This is my peeps. So I feel like such a dad when I say stuff like that. One other thing about the cuff placement is, so just like Marissa said, it's going to be up near the groin and up near the shoulder. Even if you're doing calves, if you're doing a calf press, can just still keep it up near the groin. Don't put it down by your knee or closer to your calf. Keep it up by the groin, even if you're doing something like calf press. So where the research is going and some cool things down the road, there is something called ischemic preconditioning, which is basically passive blood flow restriction, which is at full occlusion. So it's at full limb occlusion pressure. So we're occluding arterial and venous flow for 5 minutes. And then you deflate it for 3 minutes, inflate it for 5 minutes, and deflate it for 3 minutes. And you repeat that cycle before you train. And again, just passive. So you could be sitting in class, you could be probably not driving, that's probably not safe, but you could be sitting at your desk at work, in class, hanging out before you go to the gym, and you apply this ischemic preconditioning, and it's been shown to improve performance in the gym, reduce muscle damage, improve recovery. So that's something cool that we are kind of looking into a bit more. The only thing that I would say about that is you're taking about a half hour to 40 minutes to do this cycle of passive BFR. Why not just ride a bike and do some dynamic stretching and then get under the bar? I feel like I don't know any studies that compared those two things, like a standard quality warm-up versus the passive BFR. But it's still a cool thing that we're looking into a bit more. Maybe for some people that can't perform an adequate warm-up, maybe they can't use a cardio machine, or maybe they can't do some kind of dynamic stretching, maybe that passive BFR before training could be something useful. And then the other thing, like I mentioned before, is that intermittent BFR, which has huge implications for decreasing the barrier to entering the world of BFR. And I guess the last thing would be contraindications. So people who should not use BFR. Anyone who is pregnant. So not that we know that it's dangerous, but Christy, how many pregnant women do you think would raise their hand when a researcher says, hey, I'm doing this study to see if blood flow restriction training impacts a growing fetus in a woman. Would you like to sign up?
Yeah.
It's like, yeah, no, thanks. Like, I'll just kind of sit back on this one. So the reason why we say don't use it if you're pregnant is because we just don't know. And we just play it safe. The same thing with like electrical stimulation and a lot of different modalities. With pregnancy, we usually just say, hold off on it just because we don't really know. Anyone who has a history of blood clots, that's someone who we probably wouldn't want to use BFR with. BFR has not been shown to increase the risk of blood clots. It actually helps increase the kind of the substances that break up clots in the body, and actually has been shown to help reduce edema and swelling and things like that too. But if someone has a history of blood clots, probably better off not doing BFR. If someone has uncontrolled blood pressure, that's someone who we wouldn't want to use BFR with. And someone who has severe varicose veins or venous insufficiency, that's probably someone we wouldn't want to do it with either. Other than those
women.
other than those things, the precautions and contraindications are the exact same as exercise in general. So that's kind of, I guess, a good thing to mention as well.
Yeah, very important.
The passive training made me think of someone who is, maybe they work really long hours. And like you said, they're not able to jump on the bike for 30, 45 minutes before their workout. So that maybe they're wrapping up at work, they have their own office, and they're able to do something like that, just kind of on and off, to prime them, get ready for the gym. And then they don't have to spend another 45 minutes there.
Yeah. I think why it works is because it's really just like occluding and then causing the perfusion of blood, and then stopping and causing the perfusion of blood, which at the end of the day is kind of just, I don't know, increasing blood flow, maybe. But what's interesting, which kind of now just throws that theory out the window, is that you can do that passive BFR, that ischemic preconditioning, hours before your session, and you still get the same effect as if you did it right before your session. So
interesting.
Yeah, mind kind of blown there. But definitely more research to come out on that, and it's kind of cool to see where it all goes.
Yeah, interesting. It reminds me of the relaxation technique. I use this sometimes when I'm feeling really tense, but it's where you squeeze everything really, really, really hard for 10 seconds, and then you just let it all go, and it just makes you relax even more. So it's almost kind of something like that.
yeah, exactly. And that actually brings up a good thing that I wanted to mention, is that your muscles they do BFR when we contract. So when your muscles contract under load, you are squeezing your veins and occluding that blood flow. That's why we get a pump. Even without BFR, we're able to still get a pump because our muscles are occluding that blood flow out of your limb. So just like you said, if you contract your muscles, you're occluding that blood from flowing out, just like we would without BFR. So yeah, it's actually a good point.
Yeah. So full circle, Christina, that's why that blood volume stuff works, because it's basically just like a version of BFR, time under tension, whatever, with just the normal occlusion. So I think a great point to kind of draw from that is just thinking about BFR, what it is, and it's this fancy thing that we've done this whole episode on, but really it's just something that we use, a small tool to amplify the body's normal response to training. And again, just kind of putting an anchor on the back of your car, just making it a little bit harder for you to do the same amount of work. And just basically almost giving someone crippling someone in terms of what load they could use in order to get a certain stimulus.
Couldn't have summarized it better myself.
Nice. Awesome.
Well, one thing I wanted to add is, Nick, do you have any recommendations on where to get some good bands, or do you say, hey, just hop on Amazon and get something?
That's a really good question. So because I'm kind of participating in some research and I'm working with Nick with the BFR pros, we don't get any financial incentive to mention different companies. We kind of just put it all out there and then allow people to kind of make their own decision. So a couple of the big names out there, and I mean, you have prices everywhere from $7,000 to $10 on Amazon, but it really depends on what you're using it for and what your goal is. So there is the top of the line unit is called the Delphi unit, and that is $5,000 to $7,000. It has all bells and whistles on it, and that's what we used to think you needed to perform BFR safely in the clinic, at least, because in the gym, that's just anything happens in the gym, right? But if we talk about an actual medical facility, then the Delphi unit was the gold standard, and that was a huge barrier to clinicians using BFR because they thought that they had to get this expensive unit. Another great product is from Smart Tools, and it's called Smart Cuffs. And that is, I mean, it's not cheap, but it's relatively cheaper. I would probably, depending on the model, anywhere from like 500 to like 900 to a little bit over 1,000, depending if you get, you know, the top of the line model. That is going to have automatic, press a button, it's going to inflate it, find your LOP, take a percentage of it, whatever you punch in the machine, it will take that percentage. So that's a pretty good, like, I guess, high tech, easy convenience, but still somewhat pricey, but not crazy pricey like the Delphi. Then you have other ones. H Plus is another one that is a bit not cheaper, not cheaper in quality, but just cheaper financially. And that is going to have to, you're going to have to manually pump that one up, like we talked about. So you have to pump that up with a sphagmometer, whatever that, like the blood pressure cuff thing is called. If you Google that word, it's just like a very intimidating word. So so that little pump that you measure the pressure with on your blood pressure, you have to stick that in your cuff, pump it up, find your pulse, and let that process that we talked about, and then do the same thing on the other side. So again, it's a bit more inconvenient, but it's definitely much more affordable. And then you have you can use knee wraps. You can use knee wraps, which are a bit more cumbersome, I think, because it's going to be hard to wrap one arm and then wrap the other arm and properly take your pulse to make sure that you're not cutting off too much blood. But again, then you can use something like that, which is more affordable. And then even something like Marissa and I talked about in the beginning, but you want to have something with some width to it, right? So anywhere from like 5 to 18 centimeters is what they usually recommend. The wider it is, the less likely you are to damage those delicate structures like nerves and soft tissue, kind of like structures deep in your limb. The narrower it is, the more likely it'll be to kind of penetrate and get a little bit deeper. The wider it is, will be a bit safer in that aspect. And you'll have to put less pressure into it to get that occlusion. Because it's so big, you don't have to have that as much pressure on the cuff to get that full occlusion and then take your percent of LOP. So kind of a long-winded answer, but the Delphi unit is top of the line, a couple $1,000s. Smart Tools has a good option if you have the finances to do it. It's a great option, has everything automatic. And then H Plus is the manual one that you have to pump up and measure it with either a Doppler or your finger to measure the pulse. And then you have knee wraps and other things on Amazon, which again is going to be less accurate, and you're probably going to get different pressures each time you use it. But if you're looking for a quick and dirty way to introduce yourself to BFR, you can always use those things. Again, 7 out of 10 tightness is a rough estimate. Just make sure that you can feel your pulse and it feels relatively tight, and you should be okay.
Yeah. I remember, like, I've seen people tie resistance bands around their arms and legs. I've seen the knee wraps. The ones that we had, they had like a little what's it called, like a latch down to like stop the fabric from, words are hard, you know what I'm talking about, but basically like a little clip, that's the word, clip on the fabric.
That's what I had when I did the sausage arm thing.
Yeah,
I had the little thing with the pull it tight and then clip it shut, and
that's
then
exactly,
I think I was getting bruised because I was probably clipping my skin in the clip.
Yeah, I remember it was like a very thin like piece of fabric, and it was like $17 on Amazon. So I was like, cool, I'll get this. And it was just like so uncomfortable, like in my skin, like in my armpit, like right up here, and just yeah. So thicker is better for that. That's good to know.
Yeah,
I think those are the ones I have.
Yeah.
Yeah. Well, awesome. So I think this was another super good episode, and we always enjoy talking to you. And if you haven't already, guys, I would highly recommend listening to episode 7. It's a really, really good one. But we hope that you enjoyed this episode today. And if you haven't already, make sure you're subscribed to the podcast. You can find both of us on Instagram. You can find me at Christy Lynn Fit, and Marissa is at Marissa Roy Fitness. Nick, if they want to find you, where are you located?
You could, my Instagram is at Nick Licameli. You can also go to 3dmusclejourney.com. That's the number 3, letter D, and then musclejourney.com. And there you can, with 3DMJ's Vault, my free BFR course is there. If you want a visual of anything we're talking about, there are, you can see exactly what the cuffs look like, how they look when they're applied, and anything else that we talked about here, that you feel free to go in there and check it out. You can also go to the BFR Pros and Dr. Nick Rolnick. He's at the HPM on Instagram. He has, again, if you enjoy my course or enjoyed this conversation, Nick will blow this out of the water. He's just he's phenomenal and a leading person in the field of BFR. So. And also email, you could shoot me an email at nick@strengthtogetheronline.com. And yeah, I'd love to answer any questions or help out in any way possible.
Awesome. Thanks. And we'll have all of that in the show notes for you guys. But thank you guys so much for listening, and we hope to see you back next week.